Well, good afternoon, everyone. Thank you so much for joining. My name is Samantha Matlin, and I'm the Director of Evaluation and Community Impact. I am joined here by my colleague, Amin Diallo, who is assisting with everything technology here today. So thank you so much, again, for joining. We're really excited to be releasing this report in collaboration with Azavia. And I think that we have Daniel and Simon on the line, is that correct?
Yeah, and Esther's here as well.
Okay, great. Hi, Esther.
Hi.
So what we're going to do today, and we are recording the presentation so that we'll be able to post it online. I have muted everyone for now, just so that we aren't hearing background noise, but you have the ability to unmute yourself to talk. And then I'll unmute everyone too for questions towards the end. So what I'm going to do is give you a little bit of background and talk about how we got to where we are, and share a little bit more of the findings, and then ask questions from the group. If you have any questions during the presentation, please feel free to send us a chat as well. So welcome. As I said, we partnered with the Azavia group here in Philadelphia to do all of the mapping and analyses, and really be a great thought partner as well in terms of how we achieve that. So we're really grateful that they are on the phone today. So I want to start off with this map, and I want to ask you to think about how many maps of Philadelphia like this have you seen? And you might instantly know what this map is showing, or you might say, I'm not sure. It could be a few different things. So take a minute, look at it. You might notice this is a hotspot map. So the darker areas approaching, it's not quite red, it's an orange color on my computer, are where you have a lot of activity. White would be limited activity to none, and then you see the orange color. So you see there's a hotspot of the lower northeast, really north of Center City. And then you see a little bit of a hot spot emerging south of Center City. So for those of you who spend your time looking at maps, or maybe make maps, you might already know that this map is highlighting the number of overdoses related to opioids in our city. And the numbers on the map are city council districts, so there's 10 city council districts in Philadelphia. So this map was put forth as the Chamber of Commerce in Philadelphia was proud to present a roadmap for growth, uniting against the opioid crisis. And I ask you to say, well, what does this actually do? And I think this map does a good job of saying we have a problem, right? We have a lot of overdoses in the city, but we have a particular geographic problem where they're clustered in certain areas of the city. But in order to be a roadmap, you really have to think about, what does this tell you to do? So if you are of my age or older, and you remember when you first got your GPS, you would print out a Google map, which had the map, but also had step-by-step directions of how to get to the next place. And so, you know, if you mistakenly missed step 23, you have to figure out how to get back to number 23 so you can move forward. But that really is a roadmap of how to get somewhere. And for this, to me, this just says this is a problem. So if this map was called the problem of opioids and didn't say it was a roadmap, I'd say, yeah, I could agree with that. But I want to ask you, how many maps like this have you seen in Philadelphia? So for this map, does this look any different? So this is a map where the tealish color is at least half of all households are low income. Now, I don't think you have to be a genius to see there's a cluster in the same area of that lower northeast in Philadelphia, right? So you can see that, and then you see, okay, where are there at least half of all households of high income in that darker blue? And you'd say, oh, that's probably not so surprising. That's Society Hill and Old City and Chestnut Hill. So if you spent any time in Philadelphia, you would say, okay, it looks like this makes sense. West Philadelphia, North Philadelphia, and parts of Germantown are what's concentrated poverty here. Does this look that different from this map? So you have the percentage of homicides in Philadelphia by police district. So it's not city council district. There's more police districts than city council districts. But you see this darker color also having a cluster in a similar part of our city. So I'd ask you again, is this telling us new information? Is this providing a roadmap? Finally, I want to show this map, almost last, to say, let's look at unemployment in our city. And this is broken down to a finer, granular level, looking at unemployment. And the red is the highest unemployment rate. You have unemployment rates ranging from 21 to 40%. That means almost half of the adults in that neighborhood who are eligible to work are not working, right? So again, you see that upper north in Kensington are hotspots. There's also the west part of Philadelphia, again, showing a clustering of activity there. Finally, if we look at this from yet another angle, and we talk about gentrification, where the darker blue color are areas that have been quote unquote gentrified. And then you look at where in our city has income decreased. And I think that's really interesting to say is most of the city outside of Center City has seen some decreases in income. And these are again broken down to the census tract level, which is smaller than a city council or zip code. But you see here again, you have clustering in certain parts of the city, particularly the lower north, east, and west, and again in West Philadelphia. So I want to ask you to think about other maps you've seen like this. And you know, this isn't picking on the people who do the maps, which takes incredible skill and ability, and it's not picking on the people who produce these maps, because I've been part of these projects myself. But I think to say to ourselves, is this sufficient? Is this helpful? And then further to think about, because if you do what I do and you look at where you work and where you live, you ask yourself, oh, that's not so good. That doesn't feel so good to see yourself on a map like this, because most of us may not live right in Center City. So I would say when you're looking at this to think about not just your head and your kind of intellectual response to this, but what does your heart say to you? And does your heart say, this is what you want people to think about when they think about Philly? We call these the maps of woe in our office, and thinking about, is that what we want to see? Or do we want to see Philadelphia like this? Do we want to see Philadelphia as part of one of the most beautiful central parkways in a city that looks almost Parisian, right? It was intended to look of that look coming from Europe. Do we want to see economic growth in a skyline that's been changing and enhancing? You know, you may not like the architecture of some of the new buildings, but it's certainly growing, right? And we have a beautiful, right next to our city, you can see the Schuylkill Parkway Greenway, where now we have a running path and you can run through the city, you can bike through the city. And we also have tremendous, not just cute kids, we have a lot of kids who are growing up here. We have more families who are staying in the city instead of moving to more surrounding suburbs. So is this how we want to see Philadelphia? And how does that look compared to the map that we just showed you? So what we really thought during taking on this project was that having this vision of saying, how do we make maps of Philadelphia that highlight our assets in addition to our risks? So this is a map, right? It's an image of Manayunk in the towpath right there, where you see people making use of this in all different ways, right? People, I think that family is probably looking at a fish or a turtle, maybe a boater coming nearby, people running, people walking dogs, people going to a restaurant, people sitting, enjoying nature and being outside. So if this is the Philadelphia that we know and we love, why are we okay with making those kind of maps? And I would say that this kind of map makes you feel good, it probably makes you want to do more, and certainly doesn't make you want to move. So we did a Place Matters, what we call 1.0 version, which we released a few years back. And we really took some of our own lessons learned and recommendations to move to a version 2.0. And a big part of that was to partner with Xavier to develop this version 2, our Place Matters project, really recognizing that we are not GIS mapping experts by any means, but that there are partners out there that do that. We were very excited that Xavier is a B Corp, so they're really committed to working with nonprofits and social services like ourselves to make it affordable. And they're also committed really to data transparency, which was very exciting to us, because the other part of this is that we want this to be owned and looked at by people of all different places, and we want people to be able to reproduce this and challenge us and add what they think needs to be on this map. So we partnered with Azavea, and a part of that partnering was to really spend some time thinking about what should be the assets on this map. And when you look at our risks like crime and educational attainment and poverty, you wouldn't say, oh yeah, those aren't risks, those are definitely risks. But when we started to talk about assets, we said, well, is a school an asset? It could be an asset if it's a quality school, but it might be a school that's not doing so well, that's under-enrolled and maybe at risk of being closed. So we really talked about that. Same thing with parks. Green space can be a tremendous asset, but if it's not safe, if it's not lit, if it's not clean, then it's not such an asset in your community. So we spent a long time, at least probably 3 months, really talking about conceptually what does the research say to us, and then what's the available data. All of the data that we use is public data, except for the behavioral health data and the ACEs data, which is the Adverse Childhood Experience data, which I'll talk about in a minute. Behavioral health utilization is the use of behavioral health services by Medicaid claims, and SNAP utilization is food stamps. And so those two assets we talked about as being assets because we believe that accessing behavioral health services and using food benefits are ways to help individuals overcome certain challenges or relieve a financial strain of food. So we believe that's a good thing, that's an asset if people are using things that they're eligible for. You might say to me, who cares about any of this? So we also looked at social mobility and life expectancy across the city. And social mobility is just a fancier way of saying how much money are you anticipated to make in your life, depending on where you were born. And life expectancy is how long you are expected to live, depending on where you're born. And for those of you who have seen some of this data before, it's very alarming that in Philadelphia, within a 2-mile radius, there's a 20-year difference in how long you are expected to live on average. So if you live in North Philly versus Society Hill, you are expected to live 20 years less if you were born in North Philadelphia. And I would say no matter what sector or what your role is, even as a someone who lives here, that's very concerning. So we also moved to council district versus zip codes, which we did in our first iteration. And we did that to make it very clear for city council and the city of Philadelphia in terms of planning and in terms of decision making. But the data is really all cut at a census tract level. So you could put a boundary in any different way. If you like zip codes, planning districts, police departments, library, school, catchments, whatever you want to do, that's possible. We also made all of the coding available on GitHub, which Azavea taught us about, is a public resource for data sets and data syntax, so how you run data, as well as a narrative explaining projects and how you do them. And so that's part of the data transparency of this project, and if you wanted to take it and run with it, you could. So let's start to look at some of this data. So for the city overall, the first map on the left is the risk score, and the numbers are city council districts, not rankings. And so for risk, the brighter or darker, rather the yellow, the higher the risk. So you see kind of 9, 7, those darker areas in the city have higher risk. For assets, it's the opposite. So you see the highest assets are the lightest colors. So maybe not surprising, District 1, which encompasses Center City and slightly north, including Northern Liberties and Fishtown, have assets. The map on the right side then is the combination or the average of those risks and assets put together, with the teal color being the highest overall score, meaning good, and the yellows being the least or worst scores. So you see here, for example, District 1 having a much higher score than, say, District 9. So I'm going to walk you through 3 examples, 3 districts, and then all 10 districts and each district has a 2-pager are on our website at the Scattergood Foundation, where you can email them to someone or download them either by district or overall. So let's look at District 1. This district has the highest cumulative or best score. So each district has what this profile shows. So on the left side is where this is located in the city. And if you look at districts, like a lot of things, when you cut off a map, it looks very haphazard, right? Why are there these little indentations? So you have to know where you are on that map. You see that it's percent English only is 69%, foreign born 16%, percent children is only 18%. So this district actually has the least percentage of children living here in our city. And you say that's not that surprising given we also have a lot of commercial and maybe older residents. The majority race and ethnicity is white, followed by Latinx. And then the center map is what we called our potentially mitigating assets as point data. And the key down here, in case you can't read that, is really highlighting if there are federally qualified health centers, health departments, city-run health centers, schools, community schools, selected rebuild sites or parks with the green space. And you might see here some things pop out like, okay, there's a lot of triangles. Okay, those are all schools. You might see a couple of community schools located. And then you might see some SQHCs, some federally qualified health centers. On the right side then is the overall scores for this district. And these little slices of data are census tracts. And so if you spend some time looking at this, again, the best part or highest scores are these colors. And you'll see here, wow, look at this variability in colors. So every district in Philadelphia has a fair amount of variability to be thinking about. So you want to make sure to look at that when you're looking at the district. On the back page of the district, you'll see here the risks on the left and the assets on the right. And it's just cutting out the map just by the census tract. And again, it shows you how kind of strangely these things are cut. So looking here, you might say, wow, this is the best district in Philadelphia, and you have adverse childhood experiences at over 60% at the 62nd percentile. So that means that their ACE scores are higher than 62% of the city. Now, adverse childhood experiences are adults reporting on their experiences as a child, whether they experience child abuse or neglect, or household dysfunction, like having a parent with a serious mental illness or being incarcerated. On the right side here, you see the 5 assets that we looked at. You might see here, wow, look at all of these assets: high school quality, access to parks and recreation centers, and fresh food access. And you see here that's particularly concentrated along here, which is not surprising if you know this is where like the McCall public school is. If you see kind of up here through Fishtown, Northern Liberties, and you might say, yes, there's a fair amount of green space and parks there and supermarkets. You see less of people accessing food benefits and behavioral health services, but you might say, yeah, that makes sense. Maybe they're not needed in that same way. The other thing to think about here is if you see a high ACE score like this, you would think, wow, these schools and these recreation centers and libraries nearby really need to be thinking about how to be trauma informed, right? If the kids in this neighborhood are children of adults who've experienced these things or they're experiencing them themselves, you would want schools to be really attuned to how to help mitigate that risk and then prevent it in the future. So let's look at District 10, which is ranked 5th out of 5 out of 10 in the city. And this is the upper northeast over here, just to orient everyone. Again, we have the demographics similar to District 1 in terms of the percentage of children. Majority white, but second largest racial or ethnic group is Asian. And so if you look here kind of interestingly, there's much less happening on this map in terms of our point data or mitigating assets. You see a lot of concentrated green space here, but not a lot here. You might see schools again. You see a community school here. I don't see a health department center. You see one kind of at the border right here. So you can kind of just look to see, well, where are things located. And then if you look here, this gives you a sense of the breakdown of overall of how this district is doing. And you see, wow, look at these pockets that are very different colors. So let's break that down. Again, these are the risks and these are the assets. Now, I think if you look at this, you say, wow, some of the risks here are actually much less than District 1. And I'd say, yes, look at this A score compared to District 1. That is significantly, and I use that word non-statistically because we didn't test that, but that's much lower here than in District 1. And crime as well. So you see, though, this issue of poverty, right, and that's largely related to educational attainment, is still a challenge in this part of the city. Now, look at this. Look at the school quality in this part of the city, right? So that's part of the best schools are located here, and this is using school district data. There's less access to green space, like I said. You see that less on the map. Maybe less access to fresh food, some more benefit usage, and less use of behavioral health services. So if I were to look at this, I'd say, why are there such high quality schools, yet we still have folks not meeting educational outcomes that we'd be hoping for, people graduating high school and moving into secondary education, post-secondary education, excuse me. So I would say, let's work with these schools. Their schools are doing great. They have high test scores, good climate scores, good student data for their tests, but how can we help move and transition folks into higher educational opportunities, and really thinking about how does that impact poverty and unemployment? Because obviously many of these risks and assets are related to each other. So let's look at the lowest cumulative score in the city, and this will be our third and final example. Percent English only is lower than the other districts, right? But we also look at how many more children and the percentage of children are located here. There's a much higher concentration of kids living in this part of the city. You might also say, wow, the majority racial ethnic groups here are not white. They're Latinx and followed by African American. If you look here at the map, or where are these points, you see these pockets of nothing, right? You see very little green space beyond right here. Not even kind of these small, there's no small even green spaces here. You see schools, right? You notice schools, some selected rebuild sites. You see one community school right there. And then if you see here, you see there's still some variance in this district. This part of the district showing much higher risk than, let's say, this part of the district, which would be closer to Center City. And for those of you who are familiar with Philadelphia, that probably shouldn't be a surprise. So going to the more detailed level, let's look at the risk here, right? Let's look at almost every adult in this part of the city is reporting being exposed to childhood trauma. That's very significant if you think about what individuals in this community are facing. Let's look at issues of educational attainment, poverty, unemployment, and crime. So we know that this part of the city, and there is, again, some variability here, but we know that there are many individuals being exposed to factors that pose significant challenges in our life. If you look at the assets, if you think about the district we just look at the schools here. Look at the quality of the schools. Let's look at access to parks and recreation. But then let's say, wow, people are accessing benefits. We see here that people are using food benefits and behavioral health services. Now that's great because there are parts of our city where we have underutilization of benefits that people are eligible for. But I will say, if these behavioral health services aren't effective, then that's not necessarily an asset, and we really don't know that, and no one in the city knows that. There's no population level data on that. Again, but looking at this, you see there's some parts of the city, of this district, that have very high assets right here, right? And that's very different than right here and right here. So we really want you to be able to look at these things hand in hand and say, okay, we need to strengthen the schools, but these schools better be trauma informed, right? These new rec centers and libraries that are being supported by Rebuild better understand the neighborhood composition here and say, how are people accessing benefits? what other services and supports could be helpful for a community facing these kind of challenges, and how do we really recognize that amidst significant challenges, people are getting to benefits and using them? That's terrific. So you might say to me, this doesn't matter, right? Like, these are just risks and assets that we put out. At the end of the day, it doesn't change things. So let's look at the 3 districts we just looked at for life expectancy and social mobility. Life expectancy, I'm going to go on the left side first, which is District 1, right? So the highest scoring district. The U.S. average is this vertical dotted line. The city average is the darker black vertical line. And you see here the district average is just above the city average. This is the range of the life expectancy for that district, which hovers about 76 years old. So for people born in the district in this age, during those years, they're expected on average to live 76 years. The map, actually staying right there across the top, let's compare that to District 10. District 10 has a life expectancy that is just about the U.S. average, right? Higher than the city average, also showing a range getting closer to that 80 years of life. But let's go on the other end of that to District 7, the district with the highest challenges or more risk with the least assets. And you see here the district average is below the city and U.S. average, right? There's also less variability there than in the other districts. And you see there we're getting closer to 70 years of life, around 72, 73. So this might not seem like a huge contrast, but actually it is when you think about what that means in terms of how long people are expected to live. Let's think about how much people are expected to make based on where they're born. So you see the city average, the vertical dotted line, right next to the district average. District 1 is just above it. District 10 is much higher than it, almost 10 percentiles higher. And then you see for District 7, it's lower. And so what this is telling us is that you might say we have the wrong risk and we have the wrong assets, and Scattergood and Xavier, I don't know what you were thinking, but how we rank these do seem to overlay with how long you're expected to live and how much money you're expected to make. And so that to us tells us we're onto something, right? And so when we think about social mobility and how long we're supposed to live, are expected to live, these are significant outcomes in our life. So what does this all mean in terms of some takeaways? So risks and assets are not distributed equally in our city. We see that, right? There are parts of the city that have much more risk or much more assets than others, right? So if you think about school quality, for instance. And we know that assets can be helpful to mitigate risk. We know that high quality access to public education is something that can significantly change the trajectory of not just individuals' lives, but a community's life. And social mobility and life expectancy seem to be impacted by risk and assets. Now, we didn't run a statistical test of that or do a regression, but we seem to be seeing this association among them. And then to say that physical assets such as rebuild sites do seem to be distributed equally. And I would ask our city and ask ourselves, is that what we want? Are we trying to continue to promote equality, or are we trying to achieve equity? And those two things mean very different strategies. So if you want something to be equal, then yes, every city council district should get the same number of community schools and the same number of rebuild sites. But if you're actually trying to think from an equity lens, then you're really saying what parts of the city need more. How do we tailor what we are doing and how we are allocating resources to areas of need? And are those assets being implemented in a way that's consistent with that neighborhood? So if we were thinking of Philadelphia like New York, and to say maybe the kind of upper north area that we've highlighted as a risk area, maybe we should be thinking about that like a Harlem Children's Zone, where we should be pouring all the community schools there, and we should be having all the universal pre-K sites and the best quality preschool education there, and we should be investing in the libraries and the rec centers and the grocery stores all right there, because we also know that we have the most children there, right? So that's what they did in the Harlem Children's Zone, was to say, all right, we're going to take this one very specific part of their city, and we're going to invest a ton of resources in everything from schools to families, to food, to employment, and really thinking about kind of an ecosystem that can support growth and opportunity. So I also want to make sure to point out there's no district that is all good or all bad. Although that we rank these, I showed you for every district there's variability, and for every district there's a need and there's an asset. So when we're looking at these maps, although we present them in a ranking and at a city council level, we also want to be thinking about when we're implementing programs, we need to think more detailed and probably at more of a census tract type level. So where do we think we should go from here? We're asking ourselves to say what's missing, right? So we know we didn't put here arts and culture. So where are the arts and culture institutions, and where is our high utilization of those things? Because we know the arts can be so important in kids' lives and really important for every kid's life. And then we're really talking to folks like yourselves to say, well, how can we use these maps? What does this mean for us? What does this mean for a funder? How should we be investing? How should we be allocating resources? How should we be evaluating impact of initiatives, right? Should these maps change? Should we have these maps done at some regular basis? But I think for us is one of the things I want to charge all of you with, and everyone you talk to, is when you see one of these maps that we looked at in the beginning, is to say, what can we do to make this more than just a map of risk, right? And it's actually not that hard. So when you look at an opioid hotspot map, why shouldn't we have, where we have methadone treatment providers, where we have evidence-based practices happening in our city, or where you have Narcan distribution or Narcan training, right? So to say, where do we have these opportunities to really highlight what our city is doing and the assets that we can build on to really provide ourselves a roadmap for the future? So I want to thank you. We're going to take questions now. I want to just say to appreciate you coming and listening, and hopefully I'm going to hear your thoughts now. And we really look forward to more engagement opportunities around our collective work. We really see this as an opportunity for lots of folks across different sectors and different types of nonprofits, for-profits, city government, philanthropy, to come together to think about how do we push this forward for the future of our city, and to really be the great city that we can be. We know we have to do better for our children. So I'm going to stop there and open it up to questions, and I will unmute you as well. Are there any questions on the phone? Carolyn, did you have a question you wanted to type, or did you want to ask to the group? All right, she's going to type that. So I will read that and then answer it, hopefully. And please feel free to use the chat function if that's your preference. I also see some folks on this call that I don't know. So if you feel comfortable, I'd love to hear from Ron and Shannon. And if you wanted to send me a chat, that's fine too, about what organization or group you're coming from. The life expectancy, the question from Carolyn was around life expectancy. And so that data is not our data. The data is coming from some work that Robert Wood Johnson Foundation supported, and it's looking at, based on how long people have lived in those areas, they're predicting that for the future. So they look at trends over time and then look at how they're calculated. I would say also for
Sorry.
So I would also say that the question again was on how school quality is calculated, and I'll say we can provide much more details about that, but it's a combination of metrics calculated by the school district, and it includes test scores, climate scores for the schools, discipline action, and so we can give you some more details about that, but that's how it's calculated from the school district. Any other questions? So there's a question around what SNAP utilization is, and SNAP is a food benefit access. So if you are at a certain income level, you can apply for SNAP benefits, which helps you support the cost of food. So unlike WIC or other food benefits, you don't have to be part of a family. And the question around behavioral health utilization and SNAP utilization, utilization means what are the number of people who are using it who are eligible. So myself, I'm not eligible for SNAP, so for Medicaid services, so I would not be included in that number. Any other questions? I'd love to hear how people think that this, what's missing, or how we could use this. Any ideas out there or thoughts about this, even if it's not a question? And just as a reminder, we will be posting this on the Scattergood website as well as the slides. And we encourage you to you can send me a message if you have ideas about what other data we could be adding. Again, we largely are using publicly available data. So if folks are recommending private data sets or data sets that you would need access to, that would be something we would need some help with. And I do want to say from the Azavea team, if there's anything that you would like to add, please feel free to do
that. Sam, it looks like there's a question in the chat about where this is hosted, the report.
Yes, so it's on the Scattergood Foundation's website. And you can download those by district, or you can do the full packet. And I will say, in some of the ways we're planning to use this is that we are meeting with city council members to talk about what we did and what we think this means and getting their input. We are in the process of scheduling a city council member breakfast where we'll be going over all of the findings in more details with both council members and their staff. So a question came up around GitHub. GitHub is something you can all take a look at. I will say, as someone who has their PhD, it's not really organized in a way that, unless you're used to working with data syntax, it's not going to be of tremendous use. But you can look up directions and more specifics on a narrative that goes with a project. Also, if you're interested in just looking at really some creative account names people come up with on GitHub, there are many very funny icons and names. But really what it is it's for anyone who's done website coding or syntax run data, like through SAS. It's really working in a format that you have to understand syntax. So that's really what it's intended for folks that are running data systems that way. But there are instructions on how to do that. And it's a free thing you can make an account at.
Is there a link to the GitHub on the Scattergood site?
Xavier, can you remind me how folks find it through GitHub?
Sure.
Yes.
We can share a link in the chat.
Share a link. I also believe that there's a link in the actual report.
Okay. So we can add that to this presentation, a GitHub link, and then we'll make sure that it's listed also on our website. I think if you search for Scattergood Foundation also in GitHub, you would find it.
Oh.
So I don't want to do to you what I do to my adolescent therapy clients that I used to see, which was to make them sit for the full 50 minutes, even if they didn't want to talk to me. But I will say for anyone who has any remaining thoughts or questions, we really welcome feedback, your thoughts. If you'd like to come have us speak to your group, to your constituent group, whoever that is, we're also happy to come do that, happy to talk deeper about what are some of the things we think about, what we're learning from this, and some of our next steps. So I want to thank you all for spending a lovely spring afternoon with me, and I hope to see you next soon. So thank you so much.